Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
My name is Dr. Derek Barron, and welcome to another amazing episode of the Prime Health Podcast. We interview doctors, nurses, wellness experts, and healthcare leaders who are revolutionizing how we approach healthcare and longevity. We explore breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. Now, before we get into today's episode, I want to do a quick note from our sponsor. This episode of the Prime Health Podcast is brought to you by Growth Solutions, your growth partner for busy health and wellness professionals. We help health and wellness professionals with some of the biggest headaches, such as new patient lead flow, AI and tech overwhelm, and ways to streamline business operations. So here's how we change things with Grow. We find new and fun ways to generate steady flow of leads for the practice or business. We simplify the platforms for better communication and engagement of your patients or customers. And we offer clear playbooks and automations that help you run your business better. So if you've ever said this, I'm too busy to grow, too slow to scale, and too overwhelmed to fix it, that's where we'd like to step in and help you. So drop a message of the word grow below, or you can head over to LinkedIn and reach out and connect with me, and we'll have a conversation from that point in time. However, today is all about our guest. Dr. David T. Neuman, an MD, is a board-certified orthopedic surgeon and clinical director of New York Sports Care. He is a TEDx speaker twice, executive director of a nonprofit international published author and international speaker. David founded and created a digital therapeutic company called PopDoc. PopDoc creates and designs fascia training, corrective exercise therapy programs for populations that want to exercise again and age gracefully. I like the sound of that as I start to get a little bit older myself here. David is the medical director of Ultra Pain Products Incorporated. This company raises the standards in the business and durable medical equipment manufacturing and distribution. And finally, as a health and wellness entrepreneur, he wears more than two hats. He is the co-founder of a nutraceutical company called Ascore Nutraceuticals and the inventor of a device used to promote, maintain, and preserve a healthy lower back. So Dr. Neuman, welcome to the Prime Health Podcast.
So great to be here, Derek. Thank you so much. Appreciate the long-winded introduction as well. I am wearing more than one hat, and I think it keeps me young and vibrant. Thank
Absolutely.
you.
We all need that young and vibrancy to us, and we'll get into that as you go with this. So from the research I've done, what we've had kind of pre-conversation here, I know you're a huge advocate of aging gracefully, achieving a prolonged health span, and getting into routines that help you overcome pain and stay functional. So from that perspective, was there something specific that got you into medicine?
You know, let's say orthopedic surgery. I mean, medicine, I'm a very social person. I always have been. I thank my parents for that. I love to work outside, like in my dad in his garden and building things. So I got pretty good with my hands, like being social. Figured I could give back and really like to see people like feel better. I think it's good to when you're surrounded by people that feel good, appreciate you and that kind of stuff. So happened at a young age, you know, as far as like wanting to give back and be someone other than like in finance or law or something like that. So I didn't really know what else I would do. Frankly, I feel good when people, feel good, share their stories with me, and I try and help them get better. When I was like probably 11 or so, I was skiing with my friend who went off the trail, broke her femur, her thigh bone. Ooh. So I hung out with her during the whole process from like getting hurt, going down on the toboggan, going to the hospital. So that turned me on to orthopedics a little bit because I did like to use my hands and tools and everything like that. So that was probably my earliest, memory of like, oh, this is a pretty cool field. And so that happened. So that was good. Awesome. And then once again, I didn't know what else I would be an expert in. And so I just went down that pathway. I like math. I like science. I like to study, which was good and bad or whatever. So yeah, I was happy with the decision of being able to use my hands, help people get better in the field of orthopedic surgery. So yeah, it's been very fulfilling for me.
Okay. I love that. Now, I know that we'll kind of talk about some of your businesses, but I want to hit on New York Sports Care for a moment. So you were an orthopedic surgeon. You still are an orthopedic surgeon. You're still in practice. So your practice at that point was shoulders, knees. What was your practice
Yeah,
typically?
so I did some training in sports medicine at Temple University, arthroscopy, which is small incision, camera in the joint type of surgery, shoulder,
Okay.
knee, and ankle surgery, taking care of athletes. But as I come to realize, and we all do, is like whether you're run over by a car or you fall at work or you're an athlete, the injury is the same on the inside. So I
Mm,
kind of devoted my life to the business of medicine, which is like helping accident victims overcome their problems and get back
yeah.
to an active lifestyle. So New York Sports Care was really built on a sports medicine philosophy, and it was private practice. I was never affiliated with hospitals. I did a lot of outpatient arthroscopy stuff, rotator cuff, labrum, ACLs, ankle reconstruction, stuff like that. I trained it in Brooklyn, so there was a lot of fracture work involved. So
Mm,
I got to know the whole body for the most part. But my love was like getting into the arthroscope and like really kind of having some finesse in the operating room, putting the screw right where I wanted to, kind of reconstructing anatomy and helping people like get back to a lifestyle that they enjoyed.
love it. From the practice perspective, give me a success story that you remember from when you were doing your surgeries of a great outcome with patients. I know all of them had great outcomes, I'm sure, but is there one that
Well,
stands out?
yeah, it's always fulfilling when they come back at their 6 or 9 month, post-op visit, and they're really happy and they're really grateful and they're just express it to me. I think that was to me, that was the most fulfilling aspect. And everyone's different. You do the same arthroscopy to 2 or 3 different people, you're going to get different outcomes. There's a lot of variables about how people do, and just those people who have some internal like balance to their immune system and to their inflammatory system, have some motivation, have the right physical therapist, because physical therapy and rehab is just as important as the surgery. You know, for whatever reason, we are technicians in the operating room. We help restore anatomy to joints, and that's kind of what we are. But I like to embrace more of the patient being like, okay, well, and I tell patients, you're doing great, but if you're carrying too much weight, for instance, I'm like, all right, 1 pound a month. If you can go down 1 pound a month, you're going to live a happier life. Despite, my treatment of doing your ACL or doing your ankle scope, because it all is treatment. It's not cures. It's very hard to say we're curing somebody when it comes to joint surgery because joints are so delicate. So I was mostly fulfilled when at 9 months or so, the ACL comes back and he or she is just like feeling good, can squat to the floor, doesn't have much pain, is getting back their strength. To me, that made me feel good. No doubt.
Yeah. Well, I tell you, you're a doctor, David, of integrity. And I say that because there are many physicians that believe that the reason the patient gets better is because of what they did when they were, under anesthesia. That is a huge part. You couldn't get anywhere if you don't do that. But the team component to getting a patient better from the PTs, the athletic trainers, even that patient doing their work. So I commend you for saying that. Not many orthopedic surgeons would make that statement.
No, thanks for acknowledging that, Derek. I appreciate that. The chairman of my residency program, he would always joke and be like, "Okay, screw goes in, brain goes off." Meaning he would say to the doctor, "Oh, I put the screw in, now my brain goes off." But it's like whole body recovery is very important. So I so getting into my story a little bit, I had an old skiing injury back in 1991. I had surgery on my thumb
Hmm.
because I was a young, silly kid. I hurt myself skiing. I said, I'll ski through this. I'll ski through this. A year later, I'm like, oh man, this thing's not functioning. So I had to get like surgery. I had to get like a tendon put in from here into my joint. Helped for 25 years. I was very functional, but then it started to break down. So it was a good treatment, not a cure. And life is long. So I couldn't really hold the arthroscope and like for doing 5 or 7 surgeries a day. And I have a little neurologic problem where I was a little bit shaky. So I
Okay.
couldn't put the screws where I wanted to. Then I was having too much pain. So I kind of like tweaked my mindset and I pivoted out of orthopedic surgery as a full-time job to
Okay.
now being like a health and wellness entrepreneur, meaning I want to see people overcome their musculoskeletal problems so they can live a very fulfilling life. And so all my businesses these days are based on that.
So your entrepreneurial hat started as the physician, And your hat number one was in private practice. Your hat
Yep.
number two is, we'll go into one of these, and it's called Pop Doc. Can you give our listeners and our viewers a little bit of a backstory on Pop Doc?
Sure, 100%. So, it was head to the grindstone, running a private practice in Manhattan. It's kind of like I wasn't affiliated with many hospitals. I would go out to about 7 to 9 offices, twice a month, let's say, and I would be there as the orthopedic guy. And so I had like 3 PAs, another doctor, a team of like 18 people. So I did a lot of surgery. And so I wasn't able to focus on like the entrepreneurial side of things outside the operating room. Okay. And so Pop Doc was born out of rehab, being like, okay, you never know who you're going to get as a physical therapist, but if you have the tools right at your phone, right at your computer, it was like a post-op recovery. So Pop Doc stood for post-operative program documents way back in the day. That's where I wrote a book about it, and but it was almost like digital therapy. And it was also preventive orthopedic program documents. That's Pop Doc. It's a dual acronym. Now it's more preventive orthopedic program direct your own care, meaning that the programs are for businesses to give out to their populations, not rehab. It's not post-operative recovery, and it's not a workout platform. It's right in the middle. So it's fascia-based. It's fascia training for the layperson, especially the aging layperson who has an old chronic problem. Let's say their knee problem that's preventing them from exercising. So our program is it's called Exercise Again, and so it's software as a solution, meaning if businesses pick up the software, whether it's an aging community, whether it's a small business that wants to care for their employees and their families, or even doctors' offices that have a lot of people with comorbidities. That's high blood pressure, obesity, diabetes, high cholesterol. Those are comorbidities, and a lot of people with that have a lot of knee pain problems. So, and then physical therapy is not always the answer, nor is knee replacement sometimes. Yeah. So it's really about just balance, flexibility, and strength. So our program is gamified, and it's starts at one level and you kind of graduate to the next levels. And it's about fascia training. That's reintegrating your fascia system. So it's an awesome concept, and I thank the people that I've been working with over the years to help me understand more about how fascia helps kangaroos jump. It helps professional athletes do their job. You see this agility and the athleticism of these pro athletes. You're like, whoa, how do they do that? A lot of practice, but also their fascia is so well integrated. If you've had surgery, if you had injury, if you have scar tissue buildup around your fascia system, you're not going to be able to maybe age gracefully, or maybe you'll have chronic pain, you'll have stiffness, you'll have weakness. So we are a tool and a resource for businesses to help their populations do better, feel better, overcome chronic pain, and get back to the life that they love.
Okay, so just so I set the stage on this correctly, Pop Doc is really for a physician-based practice, and they use that and turn it to their patients, or explain to me kind of from top down who this best serves, and then who it serves at the end.
Yeah, so it ultimately serves the human, right?
Okay.
It ultimately serves the human being that's going to take this and start at the foundation, and then be able to go dancing again, or go gardening, or play pickleball, or golf, or do the things. Play with their grandkids, something like that, right? So everyone ages. And so the business side is, we don't really the part of the problem with version 1 of Pop Doc was really PT based, is that insurance doesn't reimburse for digital therapy. So no one was who's paying? So no one was really paying for the software, because they're oh, I'll just give somebody a handout, and if they come back, they come back. And if they do their exercise, who cares? But this is really a trackable, exercise platform where it's two-way communication, where you can engage and kind of get compliance a little bit. But really, our goal is for intrinsically motivating the human to do better. So we're outside the realm of insurance. So there are some things now in the Medicare and the federal insurance that you can get reimbursed if you're very organized and you have a nurse to follow up, and the patient does their exercise. You can get some reimbursement. So we can fit that mold. But we're really about, pay for performance type of stuff, the out-of-pocket stuff, the health, the small businesses that are self-insured, or the aging communities, the independent and assisted living facilities that have members that they want to encourage their members to stay healthy and to stay at the community so they can stay active. So those are our two big targets. The medical doctor, certainly, and we're kind of getting into the orthopedic community a little bit about, okay, if you do your surgery and you care about getting your patient to optimize outcomes, they might as well do some small range of motion stuff like gripping or something like that, active or passive motion, isometrics, something that they can do, because physical therapy is only 2 to 3 times a week. There's also 5 or 4 days in the week. It doesn't last forever. It sometimes costs money and time to get the PT and to get back. So we are a home-based solution. And you do the right exercise the right way, you are going to have less pain. You just are. It's like
so you said gamification, David. So basically, it's a routine that I can go through if I've injured my knee, and you have a process that allows me to win not only in the game itself inside of PopDoc, but win because my rehab is improved.
100%. And hopefully you feel good after doing it 3 or 4 times. So you are intrinsically motivated to do it again because it makes you feel good from a physical standpoint. And you might be able to go out for that long walk. You might be able to get off the couch easily. It could be something as simple as that. And so we know that we are making a big difference on the people that use our program. We are currently rolling out version 2 and developing version 2 of it to really kind of be a product that is also, ready to be sold type of thing. So
we'll make sure we link that PopDoc up in our show notes so people can look into that and check it out for themselves, for sure. Awesome. Because it sounds like a great program for people, for better.
It's an awesome program, and the people that use it really like it, and whether it's an individual or a business. And I know that it has a place in the world because musculoskeletal, and we're actually at the end to MSK, so we're neurologically based musculoskeletal corrective exercise. So that's still an unmet need. There's still a huge amount of healthcare expenditure and a lot of chronic pain, a lot of suffering because their fascia system is really not integrated. So by integrating your fascia system through exercise that you can do on your own is a win. It's easily a win.
Yeah, it went through anatomy classes when you truly get to look at fascia from its perspective, whether it's the low back fascia, thoracolumbar, or it's the fascia around the knee. People just think of the muscle, then what's that silver shiny stuff, and then what's the other stuff around it? So it's the kind of like the girders of what makes it strong. And if that's working on the fascia, then it's allowing the muscle to do its proper function as well.
Yeah, thank you for bringing that up, because the fascia is that mesh work that really goes from the top of your head to the tip of your toes and fingers, as well as around all organs, around all muscles, around all bones, around all joints. It's beneath your skin. It's everywhere. And it's really the intersection between your musculoskeletal system, which is your muscles, bones, and joints, and your neurological system, where all the nerves are. That's where your coordination comes from. That's where your flexibility, your posture, and strength. So it's a great place to be for PopDoc and for us, because young elite athletes, their fascia is just really firm and well trained. When you get older, from just being a human, whether it's sitting for too long or getting in accidents or having surgery, your fascia becomes a little bit discoordinated or uncoordinated. So we aim to use non-opioid solutions to get your fascia back trained well.
I love it. So PopDocs for the general population. I mean, subspecialties, but general population. Now let's jump into you being the medical director of Ultra Pain Products. So go into how that company itself is really probably more sub-niched. Would that be correct?
Yeah, certainly. Thank you. It's so I believe in durable medical equipment, which is let's say, post-operative cryotherapy, bracing, range of motion machines to help the injured post-operative patient get better. So I was the first client for a close friend of mine who owns and runs Ultra Pain Products. And so we have a great rapport for 15 to 17 years or so. And so in the last year and a half or two, he asked me to come on as medical director. So we manufacture our own at-home devices, really new technology. So one of them is portable ultrasound. One of them is red light therapy that's body part specific, and the other one's cryotherapy that's very unique and efficient at what it does. So I'm really happy to be part of that whole program. We are insurance based, and we work with injured workers. So we treat injured workers like athletes. So we get them the tools they need to succeed, to get them back to work and back to a lifestyle without chronic pain, and that they get back their functionality. So we service the country for the most part. We work with durable medical equipment companies. We have people and doctors who treat injured workers. We want to be an asset for them, so we provide service to their patients and clients to help them get back to work faster. Because when you're sitting at home on the couch, you're not helping many things, And so we think that people with the right tools and the right resources can optimize outcomes after work injuries.
Okay. So this is a workman's compensation more so driven. So this is you go in to see your doctor, you hurt yourself. He or she is able to provide a product that Ultra Pain products have that can help me to get better faster. Instead of sitting on the couch, I can use red light therapy to help along with that process.
Yeah. Or ultrasound or cryotherapy, which is like compression with cold to help kind of lower your feeling of pain, allow the inflammation and the swelling to go away. So that's kind of what it is. We kind of so hospital at home is like this new trending, words and phrase of like, okay, that's for people with chronic disease. You discharge them after a surgery of some sort or having heart failure. Hospital at home is like doctors can communicate with their patients about about their asthma, about their high cholesterol, about their high blood pressure. We're doing that for the musculoskeletal system. So we provide all these products that go to their home that supplement physical therapy, allow them to do things when they're not in front of a practitioner, and they're so self-explanatory and easy to utilize that our goal is to have short videos to help the patients understand what they're using and why they're using it, so they use it. And so that's the beauty of Ultra Pain products. We're bringing, it's a non-opioid pain relief solutions that help also with optimizing outcomes.
Okay. So where do you see Ultra Pain products in 5 years, 10 years? Like, how do you see the direction?
I love my crew that I'm working with. They're really forward thinking. They're great visionaries. So we're linking that. Well, we'd love to link up with PopDoc, meaning you have some of these portable units that are going to have a link to some exercises that are appropriate for them. So that way they can do some exercise as well as have modalities. But in the next 3 to 5 years, we're integrating the Ultra Pain product solution to an online marketplace for injured workers and for injured motor vehicle and car accident victims. Okay. If that makes sense. So if you're an injured person through car accidents or work accidents, we're going to be essentially an online community that's going to help these patients get the care they need. Physical therapists, legal, doctors, MRI facilities, all those things that they need in order to be stronger in their knowledge of what can I do to get better.
Right.
That's kind of where we're moving, is community building for these people that are sometimes neglected or sometimes don't get the care that they deserve or need, even though they are important parts of society.
Yeah. And, I know that we spoke about this earlier, how much you're into health and wellness and anti-aging and longevity. And I think that this is something that, no matter if you were in a car accident or a slip and fall and injury at work, that you're trying to create products that will help these people get better, but enhance their longevity over time.
Yeah, that's so true. And I thank you for that, because if you're a pro athlete and you get hurt on the playing field, you are getting some really great care right away, whether it's just wrapping up your ankle or getting ice or getting a massage or just getting the care and the treatment you need, because their asset is themselves to get back on the playing field. So if you do the right thing in the first, hour or day or week after injury, you're more likely to get better faster. I just think you are. I was an athlete growing up. I had my surgery. I know what it's like to recover. And so I think that what we're doing with Ultra Pain products and even with PopDoc and anything else that I'm working on is empowering the human to do the right thing and to have the resources they need in order to succeed, optimize outcomes, get over their chronic pain, get back to the things that either bring them income or make them happy, make them smile, or make them be a family man, or whatever it might be.
Yeah. Well, this brings up, I just thought of this. It's an interesting point. there's a misconception that if you're injured, you've got to go to the hospital or to the orthopedic surgeon, and not saying anything against either of those because you are one and you worked in one, essentially. Well, I guess you worked in them for your surgeries, but this is a way in which people are actually able to take active care or active control of their outcome. So with the ultra pain, they can go to a physician's office and get it. Will they be able to buy that on their own as well?
No, it's
No.
All three of our products are prescribed by a practitioner, a physician.
Okay.
So that's what separates us for a lot of these other products that you can go on and get direct to consumer products of some sort. But it doesn't mean that they're high quality. It doesn't mean that they've been indicated. It doesn't mean, and some of them are really expensive. So we believe in having a practitioner oversee the care of these injured people so they can be a support system for them. It helps a lot. Yeah, it's a great concept. And my friend, who's the owner of the company, Ari is his name, really, brilliant, visionary. And so I'm just really happy to be, part of the team. And I believe in team. So what PopDoc didn't have back then was the big team of other experts, because you can't be an expert at everything. So now we have a really robust team at PopDoc. We're, going out to raise some capital to really kind of, bring the vision to life to a more robust way.
Okay. Love that. So where do you see from what's changing in, it's hard to say, you're still in active practice. You're not doing the surgeries anymore, but I think in general, we may both agree that people are more concerned about their health than ever before. They're trying to take an active approach to becoming better. So therefore, more people are going to be looking for services like PopDoc. So I think what's happening at this point in time, it positions you for both, that physicians are looking for great outcomes for their patients. Your ultra pain products can help them with that. Patients are looking for better outcomes for themselves. PopDoc can do that for themselves. So you're in a great position for the companies as people want to become better and healthier and take control of their own health. Would you agree?
Yeah, 100%, Derek. Thank you for that. So in both of those companies, it's about bringing the resources and the tools, as well as some education, right in front of the human that's injured, right? Whether it's through the practitioner, whether it's through a business, but we want to be there as a tool and resource to help people optimize outcomes and grow old happily. My parents are older. There's some complaints every day. There's 206 joints in your body. So when you're older, at least one of them is going to be rearing up its head every day and be like, oh, now it's my shoulder, my back, my neck. There's a lot of things going on. So by reintegrating your fascia system, bringing in technology like low-level light therapy, cryo with compression and or heat, and portable ultrasound, you're giving the cells the things they need to kind of wake up and to start working better. And so it's all about, a lot of it's about that to me. It's about controlling your inflammatory or your immune system a little bit. So that way it's not as angry. It's not as imbalanced. So yes.
Okay. I want to hit on something else that we spoke about earlier as well. And it's a foundation that's called the Joint Education Research Foundation. So that hits its own sub niche as well. Can you explain that to our listeners and viewers?
Yeah, certainly. So it's Joint Education Outreach, and it's about the outreach of educating young people. That's anywhere from 12th grade down to fourth to 12th. And so we work with physicians, orthopedic or rehab physicians or chiropractors or physical therapists, someone who knows the body, and they can go into their local communities and give age-appropriate lectures and or interactive group sessions to help people understand their joints better. Because I live in New York City, and I know that the education of what a joint is not really taught in high school. Yet they're the most delicate parts of our musculoskeletal system. So when the joints are damaged, that's it. You get inflamed, you get scar tissue buildup. Those smooth joints become rough. So by educating young people about their bodies a little bit more, I think we can build the next generation of Americans that are more knowledgeable, hopefully more healthy, and hopefully just have think their mindset might be a little shifted, because there's a lot of silly people out there that do way too risky things for their body, and then they suffer the consequence.
Yeah. No, it's a great point. And on that specifically, I'll talk about the cervical spine, the neck in people. And we have these digital devices attached to our hips all the time. And kids, when you see them in a restaurant, at home, sitting in their car, the tech neck issue of they're just forward flex. And I don't think they understand that the weight of the head and that flexion, what's that causing in their neck? So I'm sure that, speaking about joints and that is something that you guys cover on that topic. Would that be correct?
100%. Yeah. And you bring up a good point. It's like, what you don't know, it leads down the wrong pathway. So the more you know, you might be a little more mindful. Oh, I got to use my phone up here.
Yes.
I got to use it less. I got to do some flexibility. I got to strengthen my back and posture muscles. I got to loosen up my front. I got to make sure my neck is fully mobile, because once they get neck pain, that's it. It's like their whole body, their fascia system gets out of whack. They get imbalanced. They get pain. They might get headaches. They might not be able to focus at school. And it's like, it's a slippery slope. And so if we can provide the education necessary through joint education outreach, it can help generations kind of like feel better. These young kids, it's way too much. Social media itself is a nightmare, but even just getting on your screen time 3 to 6 hours a day, it's some silliness. There's a lot more to life than that thing. I just think
it's very true. It's not great for the eyes. It's not great for the brain, and it surely is not great for the body. I can't say I don't use it because I do, but I know that if I sit and watch it for too long and I try and go and read something, the vision component changes, and it's very detrimental to kids. So I commend you for doing that with them.
Well, thankfully, at least in the high schools in the city, Manhattan, they've done away with having phones in the classroom. So you get to at least put it down and get the focus and not be stuck on this forward flexed, rounded posture kind of thing. It's just, but I just think things have to change. We've embraced it. It has a lot of good qualities, this phone, but there's also some negativity. And so you have to balance it better, I think.
Yeah, very, very true. So, David, I appreciate the time that we've spent together here. If people want to learn more about you and or your products, we'll share them all in the show notes so they'll be able to connect from you with that perspective. But where would you like them to go to learn more?
So there's websites that are functional. The PopDoc website is just www.pop-doc.com. It's an older website. It's direct to consumer, meaning individuals who are motivated can go down and just pull some exercises for a nominal fee, and they can just come right to their phone, desktop, laptop, tablet. ultrapainpro.com, ultrapainpro.com is maybe it's I should know that. So as we thankfully can do that, I'm going to say I'm going to have to get back to you on that. I'm going to say all right. So for Ultra Pain products, ultrapain.com is the site to go to learn more about our products. If you are an injured worker or you've been injured in a motor vehicle accident, you're treating with any doctor that cares for you, you can say, look, I want to do some stuff at home. I don't like opioids. So that kind of drives the wheel to help say, okay, we have these tools and resources. So I think I should know so yes, I think those are the places to go.
We'll drop them in the show notes below for sure. We'll make sure we
I should know that, right? The website. I know my email is ultrapainpro.com, dnewman at ultrapainpro.com. So I'm very happy to meet with anybody when it comes to that. So dnewman at pop-doc.com or dnewman at ultrapainpro.com is the way to just reach out to me for email. And we can link you up with a practitioner in your local area that has that treats injured workers and or can help you with your journey when it comes to your musculoskeletal health.
Fantastic. Well, David, Dr. Neuman, I want to say thank you very much for sharing your insights and expertise with us today. You have a very unique perspective from being a patient, a physician, a business owner, an entrepreneur of many hats, and looking to help people in practice still, helping private practice individuals, helping patients, and then helping the youth of today, which I think is important. So for our listeners and viewers, if you found today's conversation valuable, please make sure you subscribe to the Prime Health Podcast on your favorite platform or on YouTube, and then turn on your notifications so you know the next time we drop one. And it would also be helpful if you liked what Dr. Neuman had to say to share this We need more people to understand that there's cutting edge treatments for themselves, for businesses, and for young children that are out there to help them. So please do share this. It helps him and it helps people. Your friend, you never know, when you're out having coffee, it may help them if you share that. So again, until next time, remember that true wellness is a journey we're all on together. Whether you're taking charge of your own health or guiding others in theirs, every step forward matters. Take care of yourselves, and I'll see you next time.